because the ramifications are that most people who are in that situation simply cannot afford to avoid the fluoride 100%. Once it's in the water supply as a treatment, it's really difficult to completely avoid it.
Have there been studies done in Australia? Has there been any studies done? Any safety studies? We're told that it's safe and effective. Have there actually been any studies to show that it's completely safe and there's absolutely no side effects?
I haven't found any study yet where they've done clinical testing of fluoride exposure on repeated individuals experiencing symptoms and ever seen any test completed to show that it is safe. The National Health and Medical Research Council in 1991, they said, yes, there were numerous reports of people becoming ill when they had their water supply fluoridated, and they said it should be seriously considered doing proper metabolic testing to see whether or not the effects were genuine or not. Those tests have never been done.
And yet they're still claiming it's safe and effective.
They're still saying it's safe and effective, yet without that testing ever being done, and I don't think there's a precedent for that in any other medicine.
What about, like, if we take that back overseas where they've banned it in almost all European countries as a known neurotoxin, what would you say to health authorities in Australia who support fluoridation in Australia when it's known as a banned neurotoxin right through Europe?
It's about time for the testing to begin, because either you follow Europe's example and stop treatment until it's proven safe, or else do the testing to see if it's safe. And as I say, until the testing is done, I can't say that we are getting people getting sick in Australia on scientific grounds from testing done in Australia. Otherwise, we've got to then look at the European situation where they have done testing, clinical testing with teams of doctors which have confirmed people were getting sick, proper double-blind trials. People were getting sick. Dr. Hans Mullenberg in Holland, he found that the patients were getting sick when the water was fluoridated, and once those studies were done, the Dutch government ordered it to be stopped, and more inquiry should be made as to why the Australian government and the National Health and Medical Research Council, which called for testing to be done to see if the side effects were real, why didn't they look seriously at the overseas research?
So what question would you broach these authorities in Australia?
Well, the most important aspect is with patients who are reporting illness, it must be followed up. And with the authorities I've requested that it be followed up with, so far have said they absolutely wouldn't. And that leads me to think, well, perhaps they are aware of the overseas tests that have done, that have confirmed that people are getting affected. And are they trying to avoid doing similar testing here? Because with a drug that's reported to be causing side effects, then testing is done by the manufacturer, and it's often requested by the practitioners, the doctors who are prescribing the medicine. And if the tests then conclude that it's caused by some other factor other than the drug, the situation is resolved, or if it is the drug, then warnings are given for its use, and it's usually taken off the market and replaced with a safer form of medicine. But with the fluoride not being tested at all, then the mechanisms for evaluation of its safety are simply non-existent in Australia. And that, of course, means that people who are apparently suffering symptoms, which are unconfirmed because authorities won't do any testing, those people are left to their own devices to try and look after themselves, and with a drug prescription you can get it changed. Your doctor will take responsibility for evaluating it and changing it to a safer one that doesn't cause skin rashes, etc. But with the fluoride, with no testing being done and complete claims of safety being made, then it's up to the individual to have to use their own ingenuity to avoid the medicine because it's in their kitchen tap. And as a result, they put under great financial stress. I know patients who have got medical confirmation of where it's proper double-blind studies are being done, showing yes, there is side effects from fluoride, and all of that person must no longer have or be exposed to fluoride in any form. Their dentists know that, their doctors know that, but at the level of the water authorities and the government putting the fluoride in, that's where some responsibility must be initiated, where they take on the role of a classical doctor in evaluating the safety of the medicines being given. But by refusing to do it, that's what allows them to keep on saying it's safe. As I say, until the proper confirmatory studies are done, as they were done overseas, confirming side effects in America and Holland, then we still can't say it's the completely safe form of treatment.
What about effective? The word effective, they say it's safe and effective. Would you agree that water fluoridation is effective in stopping or reducing tooth decay?
I don't say it is, only on the word of dentists I've spoken to who've done proper research and published research into the effectiveness of it. And I haven't been all that concerned with that aspect because I've been focusing on the side effects. But with the studies that have been done where there's been a proper statistical analysis, scientific analysis done on effectiveness, they cannot differentiate any significant difference between the tooth decay rates in unfluoridated cities and fluoridated cities. Dr. John Cahoon, the Chief Dental Health Officer in New Zealand, he could find no difference at all in the tooth decay rates between the fluoridated and unfluoridated cities. Dr. Philip Sutton and Sir Arthur Amy's in Australia published an article pointing out the mistakes in all the studies that had assumed there was a benefit from fluoride, and various other researchers have done enormous studies where they cannot find any significant difference. So it appears to be more claims made about the benefits. But as I say, if there's any harm confirmed from the treatment, then the effectiveness or otherwise is totally irrelevant. It can't be given as a treatment if it's harming patients, forcing them to have the treatment regardless of its effectiveness.
Are you aware of the work of Dr. George Walbot?
I became aware of the work of Dr. George Walbot after the first patient in Melbourne claimed she was getting sick from the fluoride, and I went to see Dr. Philip Sutton, who was a dental researcher in Melbourne, to ask him about the possibility of the fluoride causing health problems. And he just brought out a paper by Dr. George Walbot describing the symptoms from the fluoride exposure his patients had had, and the mechanisms of researching whether or not it was like double-blind studies on the genuineness of the symptoms or otherwise. And as a result of that, we got hospital tests carried out, double-blind tests, which confirmed, yes, it was causing asthma and joint problems and immune problems and psychological problems with patients.
Has he got a publication? Has Dr. Walbot got publications that the public could read about these reports?
He's published a number of books.
Stop the tape. As Philip said, Dr. Waldbot had a few publications. Here are some of them. Try 147 of them, as listed by the International Society for Fluoride Research. Now, back to Philip.